Patients often incur multiple expenses during hospitalization, such as diagnostic tests, doctor consultations, and medicines. Likewise, several expenses may arise post-hospitalization too. However, most cashless claims under health insurance policies filed by hospitals on behalf of patients do not include these pre- and post-hospitalization expenses. So what can you do in such cases? Before we tell you that, don't forget to like, share and subscribe to our YouTube channel. Medical costs incurred before a patient is hospitalized for treatment are known as pre-hospitalization expenses. Similarly, expenses incurred post-discharge are referred to as post-hospitalization expenses. In such cases, you can file a claim for reimbursement of such expenses separately with your insurance company. Health insurance policies commonly cover such costs typically over 45 to 90 days before and after the discharge. These periods may vary depending on the insurer and the specific policy, plan, sum assured amount, and so on. For instance, HDFC Ergo's Optima Secure Health Insurance Policy and ICICI Lombard's Health Advantage Policy cover expenses incurred 60 days prior to the hospitalization and 180 days post the discharge. Tata AIG's Medicare Health Insurance Policy offers different coverage periods under two plans, Medicare Premier and Medicare Protect. Under Medicare Premier, medical expenses incurred 60 days before hospitalization are covered. Post-hospitalization coverage depends on the sum insured. For up to Rs 50 lakh, expenses incurred 90 days after discharge are covered. For sums above Rs 75 lakhs, expenses incurred 200 days after discharge are covered. Under Medicare Protect, medical expenses incurred 30 days before and 60 days after discharge are covered. Well, many policyholders are only aware of the coverage for the actual hospitalization period and may not realize that costs incurred for medical tests, consultations and treatments before being admitted to the hospital, as well as follow-up care and medication after discharge are also eligible for reimbursement. But before making a claim, it is important to understand a few key points. First, the hospitalization claims for which such expenses are claimed need to be admissible. And second, these expenses should only be with regard to the cause of hospitalization. Remember, you cannot claim medical expenses unrelated to the reason for your hospitalization. Read your policy documents carefully to understand the duration of coverage and what is included or excluded by your policy. Secondly, get the documentation right. To make a claim, you need to fill up the claim form and submit supporting documents such as doctor's consultation receipts, diagnostic test bills, and so on. You need to have the original OPD bills, and these should have the supplier's GST number and GST payments clearly listed. A doctor's prescription is also necessary to link the expenses to the hospitalization. Well, a cancelled check is also required to tell the insurer where to send the reimbursement money. And finally, you need to complete a claim form where you can reference the hospitalization claim. Hope you found this video informative, and for more such content, keep watching Moneycontrol.